Good afternoon, or I guess good morning, everyone. I'm Kathrine, Nero, here for St. Elizabeth Hospital on a wonderful day and a wonderful month. It is National Nurses Month, and we are going to be talking today with three women who are on the front lines of this pandemic over the last year, and the stories they have to tell are remarkable. So we're so glad you're here with us today. Please, let's celebrate and listen to these wonderful stories. And I want to point out first and foremost, as we are joined here by our three nurses, we are all maskless because we have all taken part in the St. Elizabeth vaccination program. We are all vaccinated. It is wonderful to be indoors without a mask safely. So that's first and foremost. But let's introduce everybody. We'll start with you, Kelly Halp. Tell us who you are and where you work.
I'm Kelly Halp. I'm a team lead at St. Elizabeth Fort Thomas on 4 Southwest.
Okay, and Jessica?
I'm Jessica Scudder. I work with Kelly, 4 Southwest and Fort Thomas.
Okay, and Patty?
My name is Patty Burns, and I'm currently working in the vaccine clinic at CTEC.
Okay, so in fact, Patty, let's start with you because you came out of retirement. You retired in 2017 and came out of retirement during the last year during this pandemic.
Yes.
Explain what you did and why you decided to do that.
Well, in my previous life, I was the manager of the infection control program at St. Elizabeth for 40 plus years. And when I left that job, I decided to wind it down a little and just do some private consulting, things like that, take it easy. And then this happened. And it was very hard. I wanted to do something to help, but it was like, what do I do? And the opportunity arose to come back and help at the vaccine clinic, and that's what I wound up doing. I've been doing it for almost 6 months now.
Incredible. And Jessica, you became a nurse during all of this. Explain that.
I did. I graduated in December, NCLEX the beginning of February, and started as a nurse middle of February. It was normal at first.
Right.
And then I think it was early March, right?
So you have almost not known nursing without a pandemic involved.
Right, yeah, like almost the entire first year of nursing was COVID.
And so you and Kelly work together. So Kelly, explain, what you do and your line of work.
So I'm the charge nurse, so I'm in charge of the floor at nights. So I just kind of assist with the nurses. I also do patient care, and so yeah.
So
right
you
there.
two worked in Fort Thomas at the St. Elizabeth there, which is where all the COVID patients went. So tell me, Kelly, what was a day in the life like? Like, I mean, what was it like walking in every day?
It was ever changing. Just as they were getting more information, things changed and things like that. So that was a big thing. We had to just roll with the changes, which was great. We had a lot of information was always coming at us. So that was always good. But, we all had set amount of patients. We did have a lower patient ratio. So there was a lot of nurses and taking care of the patients. And yeah, it was very challenging, but wonderful.
For any of you, what was it like? Let's go back to March of last year when we're getting bits and pieces of information. We're hearing about this pandemic come around. How do you prepare for something like this? Because Kelly, I assume you were the only one in a hospital at that moment, right?
Right.
So what was that like?
It was awesome, honestly. I felt very honored to be there and being a part of it and helping manage through it all. So I think it was stressful, very stressful, but it was also at the same time, I felt a blessing to be there and taking care of those patients and being, because there weren't any visitors. So it was just us with them. So, going in there, holding their hand and, spending that extra time, even though we were all garbed up, you just had to hold their hand because they were afraid and, so it was.
That's amazing.
Yeah.
And then so for a new nurse, Jessica, I would imagine that learning curve was like this. I mean, from medicine to bedside manner to all of that, right? It immediately.
It really was like they had to pull us out of orientation a little bit early just because we didn't really have a choice. And I know our manager and the educators were worried about that, but really the only thing we lacked getting pulled out of that was time management. With basically, because we can have up to six patients. With COVID, it was more 2-to-1 ratio. So they were concerned about that. But really, I feel like as bad as COVID was, it was still like a blessing because it honestly taught me like critical care. Because these patients would go from sick, but then to like sick. So, you know, we had to know what to do, and luckily we have a great team on our floor.
Yeah.
Was there any fear on your part? I mean, because in the beginning we didn't. Transmission details were difficult, and like, you know, we are all thinking we're going to get COVID from a gas pump, and like all of these things. What was it like for a medical professional trying to negotiate the science versus the rumor and all of that?
I was never scared.
I don't really
I don't
want.
feel like I was scared.
That's amazing to me,
Yeah.
because the rest of us were freaked out. I'm going to
Yeah,
tell you,
yeah,
like the
yeah.
rest of us were freaked out.
We just went to do our jobs. You know,
Yeah.
we went to take care of them, and we had the right protection. And then they offered us the the antibody test.
Oh,
Like,
yeah.
they offered us
further
that.
down the road to see.
And,
Yeah.
and none of us had it, so it's like, okay, this stuff's working. This,
Yeah.
you know,
That's true. That would give you like a sense of like, okay, this
Security.
is the PPE.
yeah, the mask
working.
is working, and
Yeah. So,
So-
Patty, for you, being out of I guess you're never out of medicine, but like coming back and hearing all of this, what at what point were you like, I got to get back in there?
That's a very difficult question, because as you see people going to work every day, and because of my background, I knew the pressure they were under. I knew the stress, but at the same time, there's a skill level here with these girls that I didn't have. You know, I was in epidemiology, I was an educator, an outbreak management, investigation. I didn't have the skills to do the bedside work. So I had to keep asking myself, what can I bring to this? How can I help? Where's my role in this? So for quite a few months, it really was just in the community and trying to remind people, follow the science. Here's how it's spread. Remember this, wear your mask. Things that were intuitive to me, but then suddenly when we saw vaccines on the horizon, I knew this is something I could bring something to, and I could really help in this arena. So that's kind of where I saw my niche, and that's how it kind of panned out.
I know there are many of us, myself included, that were refreshing that my chart like
Yes.
over and over, trying to get that appointment.
Oh my gosh.
For my in-laws, I'm like, I'm gonna get you this appointment. Right? So that first wave of
Yes.
vaccinations
Yes.
had to be like no one's thrilled to get a vaccine until now. Like this had to be people were so excited.
People were so excited. It was unbelievable to me. And if I have time, I'll tell one quick story.
Absolutely.
This was very early in February, and it was a Monday morning when we were expecting a big snowstorm. And this older gentleman came in. He was in his upper 80s with his wife, and early on a Monday morning. And I said, boy, this is something. You guys are out early. He said, we stayed in a hotel down the street last night. And he said, I was determined to get my wife here this morning. And there they were. And that we heard that story over and over again. And he said, I told her it was her Valentine's Day present. Isn't that great? I mean,
That's true love.
so
You know,
grateful.
it really is.
People were so grateful, and they were just trying so hard to get in there. It was just one story like that after another.
So on a day-to-day basis, let's talk through this, because obviously your experiences are different than yours. But for either of you there in at Fort Thomas, what was it like going in every day? It was every day different. Were there protocols obviously that were in place, but how was it as that frontline worker?
I would say in the beginning it was always changing. You know what I mean? So it was coming in, okay, how are we doing this now? How are we doing that now? The communication from leadership was amazing. Like, I literally brag all the time. Like, we have been so well cared for through St. Elizabeth. Like, they updated us all the time. And it was just, following with the protocols and being in charge. I have to, okay, this is how we're doing it now. Yesterday we did it this way. Today we're doing it this way. So things
Was that
like that.
difficult when things would change like that?
Yeah. I mean, just kind of keep, you got to keep it all straight and everything. Right. So, but that's kind of nursing. Nursing's ever changing. Your patient's ever changing.
Yeah.
So it's like, and especially with COVID, they were ever changing. So I think really just the change, a lot of, in the very beginning, that was the big thing, is just kind of keeping up with how we're doing it. What's the best way to do this? What's the best way to do that?
right, I agree. And they did do very well. Emails constantly of what's going on. And our huddle board was always updated with what's different,
protocols.
how we're going to do
The
this now.
communication really important. What about now? How's it changed now?
Now it's
now
It's easy? No,
now
nothing's
it's just
easy.
back to normal.
Yeah.
I guess.
I think this week we had, one or two COVIDs?
There's two. We have two.
Two COVIDs. So from
what a great
23
change.
to 2,
It's a great
big
change.
difference.
Yeah.
Yeah,
Do any of you, and Patty told one story, do you have any particular stories that just stand out to you that you can share with us?
I think Kelly and I have one with a patient in common that he was COVID and he was, of course, all alone. But he kept holding on, and we could not figure out.
Yeah, I kept saying he's holding on for something. He needs some kind of closure or something.
So I think, did somebody call? So I think we contacted the family somehow and asked, like, would he want last rites? Would he want a priest?
Yeah.
And she was like, oh yeah, he is a devout Catholic. So another nurse was with us, Emily, and we got a hold of her uncle. I
Uncle
believe.
is a priest.
That's a priest.
Yeah.
And they weren't able to do last rites over the phone.
At that time.
But-
Like,
So even the priest couldn't come
But
in at
No.
that
no.
point. Wow.
But he did pray with him. We
Oh.
put him on speakerphone.
and gave a,
And
beautiful
so
prayers.
we stood in there with him, held his hand, and then he went.
A few tears might have fallen.
Just,
I don't know how they couldn't, honestly.
few.
Just reading
Yeah.
obituaries, unfortunately. And that's, at a certain age, you start doing that. And
Right.
it is frightening, to see the numbers. And I don't see how you couldn't get emotional.
And I did
Yeah,
have one patient that I just happened to notice his last name was familiar to me, and I was like, are you from Bracken County? And that's where I'm from. And yeah, he was, and I was like, are you so-and-so's dad? And he's like, I am. So he was like, this is great. You literally brought a piece of home to me.
Oh.
Because he has all alone, no visitors. So we were able to talk about people we know in common. My kids knew his grandkids, and he's like, this, you just brought home here. So I thought that was really nice. And then we did have a family of a patient we cared for give us all these angel pins. They sent them to the hospital. Oh my gosh, and we got food, and we got
So much from the
So-
community.
Well, let's talk about that. How was this? I mean, it's Nurses Month, so we're celebrating you guys now. But over the last year, this is, first of all, had to have been the most difficult one in your nursing careers.
yes,
But how has the public responded to each of you? Patty, you
I
want
also
to talk?
tell you that every other person who came through the clinic raved, thank you for what you do. And my response was always, this is nothing compared to what other people are doing. No, thank you for being here. Thank you for giving this vaccine. Thank you for working this clinic. Thank you, thank you, thank you. It was almost embarrassing at times because you didn't feel worthy of what they were saying. Now, you all should feel worthy, but it's amazing how grateful people are.
Yeah, like I went through a drive-through a couple times, and they were like, "Oh, it's on us."
I love that.
Thank you
Yeah.
for what you do.
Oh, that's
I
great.
love it.
But I think we had a great outpouring on our floor, especially. I mean, the whole hospital actually.
Yeah.
The
A lot of
constant-
different restaurants would send food in. There was oh my gosh, I wish I remember the name of the bakery downtown. They would send us like dinners, bread bowls.
Nice.
Yeah, I mean, a lot of companies sent in
Lots.
food. Yes, I mean, we were always being fed by the community and stuff, so it was pretty awesome.
What about within the hospital? Because obviously what you guys are doing on your floor is different. And there's a whole other part of the hospital having to go, continue in do their day-to-day work. How was that with other departments and other floors kind of working together?
Well, we had to work very closely together
Yeah.
because we were all relying on each other. So there was a lot of communicating, and really, I think it brought us. Fort Thomas is a very family-oriented hospital. It's like you walk the halls and everyone's like, "Oh, hey, how are you? How's your son? How's it?" I mean, everybody knows everybody. It's beautiful. So it just kind of even brought us closer together as a family. Plus, we had a lot of nurses coming in. Like the float pool was assigned to us a lot. So it was just like them welcoming them in, and I feel like it was.
I do, and Fort Thomas was all COVID, so we
Yeah.
all were doing the same thing, really.
Yeah.
What about that transition to go from a hospital that's just traditional hospital to, okay, now it's a COVID hospital? How was that?
So they had to make all the rooms negative pressure. That was interesting.
Yeah.
Explain that. What does that mean exactly?
So it's the way the air circulates. So
Okay.
that, so we had to have one of our rooms was blocked off with all the equipment, and then you had to keep every door closed because the way they did the venting, and then you had to go around and like test it to make sure the air is being pulled into the rooms and not coming
not out.
So we have one negative pressure room normally on our floor,
Okay.
and then all 22 because we had one as storage, but all became the negative
So
pressure.
that had to immediately happen. Okay. What
Yeah.
other changes?
So they would do like a floor at a time, right?
Okay.
Like, so like our unit was closed. So then we would go help other units.
Okay.
And then they'd reopen ours, like close another to make it negative pressure, and they'd come help. So we were getting pulled to and from floors. So we worked really well together with that, I think. There was a lot we had to adjust to, but I really feel like we did it well.
Yeah.
It was huge changes.
And Kelly,
Every day.
you had some superstitions, you said, during all of this, right? You wore the same shirt.
Yes. So my faith is what got me through all of this. Like, I just relied on God, and when I became a nurse because I want to be God to my like I could cry right now. Like I see God in my patients. Like I want to be God to Jesus to them, and I see Jesus in them. So when I'm caring for them, and especially during that, I had a quote from Mother Teresa. So I have a Mother Teresa tank top on.
She's wearing it right now,
Yes.
in fact, yes.
It was my inspiration for today because I knew I'd be guided. The saying is, when I actually wrote it down on this card because I wouldn't remember exactly. I see God in every human being. When I wash the leper's wounds, I feel I am nursing the Lord himself. So that was Mother Teresa's, and I kind of used that when I went into my patients' rooms because in 2020, that is leprosy. You know what I mean?
It is.
It was leprosy to us. Like it was. We didn't know if we were going to get it. We didn't know if we were going to bring it home to our family. And it was just, you know what? I am here to do God's work. So I will do it. And if I get put at risk, I get put at risk. But I'm here to serve. I'm here to be God's servant. So, I mean, that was what got me through every single day.
You mentioned family. How was your family with all of this? What was their reaction, concern in all of this?
I would say my daughter Emma was probably the most concerned because she's a high schooler. Well, she just graduated yesterday, but very concerned about getting sick and all that kind of stuff. So it was kind of hard on her, but I had my method of when I came home from work, how I took my clothes off and what, I only used a certain shower. No one else used it just because at that time we didn't know. We had no idea. So, the hospital provided us different scrubs, but I'm kind of a germ person, so I
That's a good thing in a nurse.
Yes,
I think.
it really
It's
is.
a really good thing.
Yes. So, my son and my husband were a little more laid back, but yeah, it was hard on them because my daughter feared something was going to happen to her mom. You know what I mean? So, but she wants to be a nurse, so I must not have scared her too much.
Yeah, just enough. They're just enough. What about you, Jessica?
My kids, if they were worried, they didn't really show it. They were more like, what if we get sick, then we can't go here? If you get sick, we have to quarantine, that type of thing. My mom was more concerned and always, be careful, you do what you're supposed to do. You wear that,
Yeah.
But the same as with Kelly and everybody else for that matter, really, you just wore the green scrubs the hospital offered, went home in your clean clothes, but still strip those off.
Because
shower
what if?
Yeah,
There's
it's just
something
that.
as you're walking out,
So I guess
you had to be very careful.
That was the only fear. I wasn't fearing getting it myself, but I did fear taking it home to my kids or especially to my mom. But luckily, that never happened. So
Shows you that masking works,
Yeah,
doesn't it?
it does, yeah.
What about you, Patty? I want to know what your family thought when you're like, I'm going back in.
Well, my family have lived this my entire life, so they're used to discussions about hepatitis at the dinner table, or AIDS, or Ebola, so I don't think it was a great shock, and I don't think they were shocked at all that I was going to be doing this. So I just tried to keep it the same way, and like I've said it 1,000 times in my life, follow the science, listen, follow the science. So that's what we did, and I just tried to keep reminding them, because the hysteria was in the community as well as in the hospital, just what the science says, and it'll get us all through, and it did. So I think they were glad. I don't think they had any concerns because they knew that I wasn't going to do anything, irrational or unsafe. So yeah.
Let's talk about that hysteria, because that is something that has divided this country.
Yes.
That was already divided, and maybe even more so. What is your reaction when you hear people say, masks don't work, COVID is fake, I'm not getting a vaccine. What is your response to that?
My response is it's very reckless. It in no way moves us forward. It puts people at risk. And again, if you look to the science, I don't see how you can hold those kind of beliefs and say those kinds of things. And I do think it's reckless. And I just have to carefully measure my words when I'm having conversations, because it is not, it does put people at risk. And I think we who feel the opposite way have to not be, you can be polite, but you cannot hold your tongue, because it does put people at risk. So that's how I'm dealing with it. And that's sort of a change, because it is not my tendency to be out there, you know, with a banner or anything like that. But in a case like this, you have to speak the truth, and you have to speak the science.
What about you guys?
I think my big thing was the whole, oh, it's fake.
Yeah.
I'm like, well, come to work with me.
Yeah,
Come
what do
see
they
what
think
we
you're doing
see.
all day?
Yeah,
right?
and if these people are faking this, they're really good.
They're really good at
they're
it.
really
Yeah.
good, because if they can make their oxygen drop that low, then I mean they're pretty.
Or the
they're
people
pretty
that are like, well,
good.
so and so had it and they were fine. Okay,
Obviously.
well, she might be fine, but
that doesn't mean it's not going to affect this
yeah,
person in a
this
different way.
person could be 20 years younger than so and healthy and tank within
Yeah.
minutes.
Yeah.
So it just affects everybody differently. It's very frustrating to hear people say, oh, it's fake, or I'm not wearing a mask, I don't care. You know, and like, well, like she said, come to work with us one night and just, you know, I had one night 2 patients, both tanked at the same time. Both, like, at the same time.
Yeah, and that's the thing with the COVID patients, you had to be on top of them. Like, one of the changes I didn't mention is we became telemetry too. So we could
Explain
take,
for those of us
Okay,
not
sure.
in the medical field what that means.
so we're a med surge floor. So
Okay.
we have patients that don't wear the cardiac monitors.
Okay.
So one of the changes St. Elizabeth did is they put cardiac monitoring in all of our rooms. So that way you could watch them on the monitor, their heart rate, their respirations, oxygenation, and all that stuff. So that was very helpful, because they literally could change in moments, and that was a huge thing. You had to stay on it. Like, being in charge, I made a paper so that I could see, okay, at the start of my shift, they were on 7 liters, high flow. Oh, they're getting better, because I kind of would just track it that way. Oh, this guy he started at 2, now he's on, you know, whatever, you know. And it's like, we were doing heated high flow, we were doing masks over top of that, you know, just to keep their oxygenation up. And you just had to be on your toes and monitoring and assessing constantly.
At its peak, how many patients did you have with COVID at once?
Like each
Like
nurse,
per
or
nurse?
Or total, like the
Oh, we were
at
at
full
capacity.
capacity. So how many is
there
that?
was our floor holds 23.
23.
So
The
really
hospital was
22,
what,
but we were
200 and something beds, I think, when it was at
And so
capacity.
you guys were responsible for two patients.
2
2,
to
3. It kind of just depended.
Wow.
It just, that was a change too. That was a change. The ratio changed
Because of how difficult it was to care for them.
And the close
What
monitoring.
medically are there things, protocols, practices that have been put into place that you think will continue, that, you know, after this pandemic ends, that you guys will probably still keep doing?
I don't know if the
Mask,
mask
maybe?
wearing,
Yeah.
you know, I mean, if we'll continue to do that, because you never know who's coming in the door and what they have. You know what I mean? Like, they could be COVID, you know, and we
Yeah.
don't know it. They could be
Certainly
showing the
kept the flu
classic
numbers
symptoms.
down this year.
did. Yeah.
Yeah, so, I mean, that would be the main thing. At least on our
think so.
floor, it would be maybe mask wearing, because otherwise we're pretty much getting
same.
back to normal. Except
Isn't that
masks.
nice to say?
I
Getting back to
know.
normal.
It really
Yes.
is.
So
We're like,
just
this
your
is
normal
normal.
amount of
Yes.
hard work, not
But
the
it's like-
excessive amount of hard
Yeah,
work.
and it's just so weird, the difference in the care that we are giving and providing, and the focus, and, you know, getting back into our post-op patients and our just COPDers that are just, you know, dealing with their oxygenation. You know, it is just like, okay, now let's turn that brain back on, because we
Yeah.
were
Right.
so COVID focused, and now let's turn our brain back on to med surge and, you know, post-ops and all that kind of
It's
stuff.
so nice to not have to put on all that stuff. Because you would put on all that stuff and come out and you get clean. And then ding.
And you have to go right
and
back
they
in
need you.
again.
Yeah. And no matter how small the item was they need it, you still had to
Put everything.
everything back
Oh,
on
wow.
to go back in. And so they always laugh at me because I'm hot all the time.
All the time.
So I come out, one funny story, I had a lady and I had a blood pressure med to give her. The blood pressure, it wouldn't work. They had the cardiac monitors. It would not work. So I'm like, okay, it's going to be fine. So I thought, I'll do the automatic. I'll do manual. Didn't work. I'm like, what? I don't understand why this isn't working, but it wouldn't work. So I'm fidgeting with the thing and it wouldn't work. So I hit the call. We had to do that a lot.
We were a major team. Like, 'cause
Yeah.
when you're in the room, you don't want to have to unguard to just go
Right.
grab that one thing.
Right.
So,
Hit the
I mean,
call light,
it was
yeah.
a lot of teamwork.
I'm like, I need somebody that this isn't working. I need somebody to fix this. So she comes to the door, the nurse, and she's like, I don't know anything about these. I'm like, okay, I'll try again. So I'm fidgeting with it again, and it would not work. So I had to hit the call light again. She came to the door. I'm like, you have about 5 minutes before you scrape me off the floor. I'm like drenched. So finally somebody came in and figured it out. But oh my gosh, I thought I literally had to change, like drenched.
You know, and that's the thing. We saw all the, the pictures of nurses in all of the PPE, but you're right. It's the little things like, oh, I need to go grab this one thing, and now you've got to start everything all over again.
Yeah.
I bet you learned pretty quickly how to make that work teamwork.
We
wise,
really
yes.
did. I think we came out. We were already a strong team,
Yeah.
and it just is even more so now.
I love hearing this talk about the teamwork, because when the infectious disease response team was a dream back in 2014, 2015, hours were spent discussing exactly what you guys are describing. How are we going to get in and out of the rooms? Who's going to be outside? Who's going to bring this
Yep.
in?
We had
where are the
runners.
changing
Yeah.
rooms?
Oh, yeah.
How long is this going to take? And it is so wonderful to listen to this, that it worked. It was put into practice,
really did.
and
Yeah.
it allowed you to care for the patient. So it's just this full circle to let you know all that work early on. And we thought we were planning for Ebola.
I was going to say,
Yeah.
'cause
Or-
you were involved in that. This
Yeah,
was your
yeah.
baby, if you will.
It was, and we thought we were planning for the worldwide Ebola, but never happened. But instead, 2.5 years later, we have this. Who knew?
Yeah.
You know, we always knew something was going to come, but whether it was coronavirus or it was swine flu or some other avian flu,
Right.
but this is exactly the way it was supposed to work. And we are all very lucky to have been a part of St. Elizabeth, because forward thinking, resources were always there. What we said we needed, we got. If we said we needed 400 pairs of shoes for the IDRT, we got them. You know, so that was just a wonderful process.
I agree.
And it came to fruition, and there it was. Whereas other places that did not do the pre-planning were kind of caught, like, oh my gosh,
Yeah.
this worked like clockwork, which made us all, even those of us who weren't there, made us proud to know,
Yeah.
hey, you know, we did work hard back then, and look what happened. It protected these people. And
So,
Yeah.
looking back on this last year and a half, what have you learned? This is obviously a huge lesson that this
Oh my
worked,
gosh.
right? What else have you learned that you'll take forward?
I'll start. I'll tell you just one thing that I learned. I thought I was beyond being proud to be a nurse, that, you know, that was my career and I loved every second of it. But one day in the clinic, I was there and I was looking around at the people working the clinic. And I looked over there and I saw a woman who was the administrator of the extended care unit and the hospice unit and the home care unit. I looked over and saw somebody who headed up the organizational education department. I saw a cardiology nurse practitioner. I saw the head of the emergency response for the entire area. All these people are working in a vaccine clinic to get us out of this mess. I was so proud and so humbled to be there with them. But I thought, no one else knows who these people were. They just think they're nurses.
Right.
And they are nurses, and they're proud to be nurses, and they're proud to give a vaccine. But I thought the knowledge And the experience in this room just made me really proud to be a nurse still after all these years. And then I look, she's a brand new nurse. How proud she is of herself because she made it through this year.
Yeah.
And she's a manager of a COVID unit. How proud you are of yourself. So you know what? It does make you proud to be a nurse, to be a St. Elizabeth nurse. We will always be St. Elizabeth nurses. So that's what I learned this year.
I think I just learned, wow, I don't even know, think more of just being ever changing and being able to roll with the punches. And that's such a huge thing in nursing. I don't know. I feel like it, I don't know if it as much taught me anything, but made me, didn't change who I am, but just made me more, I don't know what
More
the word,
aware.
more aware and more of how things can change and
Yeah.
something can come up tomorrow and you know,
Yeah.
probably more something along those lines.
I think for me, it's how much just a little bit of compassion
Can go.
can go. And just be able, we were their family.
Yeah.
Yeah.
For all of them, we
Yeah.
were their family.
Yeah.
Yeah.
And
The empathizing with them.
Yeah.
And, I mean, literally, it was like you had to go in there and you had to have a smile on your face under your mask
Yeah.
because they can see your
Yeah.
eyes. You know, if you're going in there and you're like, oh, like nervous about something's going on with them, you got to go in there like, okay, well, things are, do this. And, and you had to be like positive and, okay, so just take some good deep breaths and we're going to do this and we got to change this around and we need you to, because there was proning where you had to
need you to lay
position
prone,
them
yeah.
in certain ways. And it's scary when you're walking in there and you know, who you're reaching for, you're wanting your family.
Yeah.
And we were that
Yeah.
family and just the compassion.
And then when they
and
try
empathy.
to see that monitor what their oxygen was, and it's like, I don't
really
want you to see that
Angle
right
that a
now.
little way. Yeah.
Yeah.
Because it would, they would be 90, and then all of a sudden it's like 76. And it's like, okay.
Not coming up.
Yeah.
then.
So I just, compassion is what, just the smallest amount
Can go
can
so far.
go so far. Yeah.
We have talked at length outside of this conversation in the community with our families about the negatives of COVID. There are a million negatives of COVID. No one wanted it to happen or wants it to happen again. However, we have learned there have been some really good positive experiences over the last year. I know just, with families, spending more time with your kids, learning, how they are on a day-to-day basis, their learning styles and things like that.
Right.
But for you guys, what are the positives that you'll take away from the last 15, 16 months?
The honor. Oh,
Go ahead. No, you go ahead.
The honor that it was to take care of them. Honestly, that is what I will take away from this. I just truly, and I said it all the time, I'm like, are you okay? Are you doing all right? I'm like, absolutely. I am honored. I love it. I didn't mind going into work. I looked forward to it. It was a total honor. Like it really
agree.
was. I am so glad I was in the heart of it all and in there and taking care of the people and making a difference in their lives. So
And just to see the teamwork on our floor, like
Yeah.
I was comfortable starting as a nurse on our floor because I was the nurse assistant on that floor while I was in school, so that did help. But just to see, like I had, fantastic coworkers on night shift, and then I did tell her that I was going to tell her about her, Courtney, a fantastic preceptor. Because in orientation you do some days, and one of the last days of my day shift orientation, we did have a patient that she was sick. We don't really know what was going on, but we were in there with her, and this was when we were like getting our floor emptied out. So patients were getting transferred to Florence, patients were getting transferred to Edgewood.
Gotcha.
Over to the other side, because at one point,
the med surge, not the COVID people.
right, at one point it was going to just be the southwest side was going to be COVID, and the south side was going to be normal, and then that changed and it ended
Right.
up all being COVID. But so they were transferring people out no matter what not COVID, but other illnesses. And we were in there, and while we were in there, we had her cough and deep breathe, we're just trying to figure out what's going on and assess her, and a nurse assistant knocked on the door and she's holding a mask, and we're like, what's going on? And so I sort of walked to the door and they're like, they think she might have COVID. it's, I'm like, Courtney, I need you over here a minute. So, when we came out, but honestly, she had no fear. She was like, okay, all right. We put the mask on, went back in, took care of her, and that was like, okay, well, that's what this job is. There can't be fear. You just have to do it. So that was a big learning point for me to see, like, okay, it's our job.
Yeah.
We still have to take care of her no matter what they think she might have. This is and so that was my very first COVID experience. And then from there, it all went downhill. No, I'm kidding. But that's literally when it started. I think I was probably, a week in
Probably.
to orientation, like on the floor.
Wow.
So
Trial by fire, really.
yeah, really.
Yeah.
And the teamwork that I saw come out of it was, like I said, it was already such a great team.
And our poor manager just became a manager
Yeah.
in February.
Oh my God.
Yes, and she rocked it. I mean,
amazing.
she was an assistant nurse manager over at Edgewood, and then took our manager's position, and 1 month in, she gets turned to a COVID unit. So
And she
Ashley did amazing. Her
amazing.
communication, and I went on. She did a great job, and so I think that was
so
huge.
the teamwork is just huge in her. And like I was going to say, if a bed alarm went off, you didn't gown up yourself. You had somebody was putting your gown on, they had gloves on, ready to go.
Yeah.
You're running down the hall with like 4 people tying masks, putting stuff on.
wow.
So it's like, it was an interesting year, but a rewarding year.
What about you? What's the positives that you'll take away from this year?
I think a few things. I reinforced my respect for people who work in healthcare, and I've been around them my entire life, and I've always had ultimate respect for healthcare workers. But it just reinforced it this year that everyone who showed up to work every day, didn't complain, just went and did their jobs. Like you've both just said, it's my job, it's what I do. So that just totally reinforces that to me, that respect. And then on a personal basis, I think it just helped me realize what I need in my life and what I don't need. What I need are people, the people I love. I need to be able to talk to them, to be with them. And when I can't do that, I miss it. What I don't need trips. I like them, I'll take them again, but I don't need them. I don't need a lot of stuff. I don't need to shop. I may never shop again. I found out I don't have to.
Curbside pickup is my favorite thing. I'll tell you that. That's like, I hope that never goes away.
Yeah, exactly. So I think it did. It just reinforced to me, what do I need? What did I miss? I miss people. And again, I have the ultimate respect for nurses. And you are so right. You were family to everyone. You helped them get through. And everyone will be forever grateful to these people for doing what they did throughout
Absolutely.
the year.
You said it, Jessica, you said it's an interesting year, but a rewarding year. That's
Yeah.
exactly it.
Yeah.
Well, it
That
is
is
National
perfect.
Nurses Month, so happy National Nurses Month. You've
you.
inspired the next generation of healthcare workers. I'll tell you, there are people clamoring
right.
in nursing schools right now. I just know it after seeing this and after seeing what you guys have done, and all of your colleagues as well over the last 15, 16 months, and we thank you so much. We call it front lines for a reason. We thank you for your service. We do. Thank
absolutely.
you guys so much, Patty and Jessica and Kelly, and thank you guys for joining us here. And you know what? If you hit share on this, more people get to know these great stories. So enjoy, celebrate National Nurses Month. Thank your favorite nurse, and thank you for joining us here on Facebook Live.